Scoliosis isn't essentially painful, relying on elements like the patient's age, severity, and shape of the condition. For kids and adolescents, pain isn't an ordinary sign, making it difficult to diagnose. Still, you can do several home tests to check your spine. In this video, on the parshealthTV channel, we are going to be sharing with you some ways to help you diagnose your scoliosis. Scoliosis pain will feel different from one person to another. Factors such as age, causation, curvature area, and condition severity will form a person's living experience with the disorder. Especially when it comes to pain and discomfort, scoliosis feels very distinctly for young patients who are still growing versus grown-ups. Scoliosis is a highly varying case that can range from mild to moderate and severe, which is the reason why there is no one-size-fits-all description of what it feels like to have scoliosis. Each patient's experience is distinctive and shaped by several important patient/condition variables. With scoliosis, there are lots of uneven forces when you are at work. Feeling stiffness on one side of the body is understandable as spinal rigidity raises with curvature progression. The muscles surrounding your spine also work unevenly because they try to compensate for the uneven pressure of the unnatural spinal curvature and support the spine. When an abnormal curvature is present, the body becomes asymmetrical as the spine's biomechanics are thrown off, which can give the appearance and feel of the legs hanging at different lengths. The sensation of being pulled down is also understood as a result of the adverse tension that scoliosis presents to the spine. The feeling of the body being stretched and pulled is a common report as the spine and the rest of the body face the compressive nature of the abnormal curvature. This can also impact balance and make patients feel like they can't completely get comfortable in their bodies. Feeling fragile has a psychological element as patients can feel concerned about the spine's ability to evenly absorb and distribute pressure. There is also the fear of trying new movements and not knowing how the spine will respond. A general asymmetry in the body is a typical sign of scoliosis, including in the hips. One can sit higher than the other, or one side can seem more rounded/flatter than the other. This is particularly characteristic of curvatures in the thoracic and lumbar spine. If you haven't subscribed yet, please subscribe to our channel and press the notification bell. Now, let's dive right into the different kinds of scoliosis. Scoliosis and the different types. Before checking yourself or another for scoliosis, it is crucial to know the various types of scoliosis your case may be and how it was generated. The most commonly diagnosed scoliosis subtype is idiopathic scoliosis. It has no known cause. However, the other kinds of scoliosis include functional, neuromuscular, and degenerative. Functional scoliosis. Functional scoliosis is brought on by other problems elsewhere in the body, such as muscle spasms or one leg being shorter than the other. Neuromuscular scoliosis. Neuromuscular scoliosis is driven by neurologic and/or muscular ailments. It requires the most attention by a doctor because of its severity. In this state, the nerves and muscles cannot support and maintain the spine and trunk. This kind of scoliosis can stem from a brain or spinal cord disorder or other neurologic disorders such as muscular dystrophy or cerebral palsy. Degenerative scoliosis. Degenerative scoliosis influences older adults after years of the regular wear and tear of the vertebral discs in the back. The most significant contributor to this kind of scoliosis is the vertebral fractures, which cause portions of the vertebrae to collapse. As the discs collapse and lose height over time, the shape change leads to an abnormal spine curve. How to check for scoliosis. Scoliosis treatment is basically like a clock race. When noticed early, doctors can guide you through correctional movements and suggest natural therapy to help minimize the results of this chronic state. Unfortunately, most patients go undiagnosed until the curvature of the spine has gone to advanced levels. This makes effective treatment more challenging, making the patient suffer even more. However, you can do an at-home scoliosis test for your kid and even yourself with the aid of an observant friend. Here's the easy process to do so. Number 5. Using the forward bend test. Depending on your state, you may remember doing an easy scoliosis check in the nurse's office at school. Schools operate the Adams forward bend test for scoliosis screenings, which can also be utilized at home to determine spine abnormalities. Bending forward at the waist with your feet together reveals asymmetry or imbalance in the back. With someone watching from behind, this asymmetry in the back can usually be found in the rib cage or hips and may be a cue that you have scoliosis. Number 4. Standing straight. Postural transformations are one of scoliosis's most common visual signs before the spinal curve becomes observable. Observe the individual's posture in the straight standing positions. If you notice signs of one shoulder being higher than the others or indications that the hips are imbalanced, then you should consult with your doctor. Number 3. The clothes check. Sometimes the fit of clothes can be an indicative sign of scoliosis. Evaluate the situation for uneven hemlines, such as shirt sleeves or pant legs hanging lower than the other. Number 2. Eyes and ears. Does one eye or ear seem to be placed above the other? While this can be normal, it can also be a telltale of scoliosis. Number 1. The gait test. Watch the test participants walk and look for abnormalities like a slight limp, one leg being shorter than the other, or any signs that the body appears to tilt to one side. As scoliosis is a developing disorder with no known cure, you can see how critical it is to develop a strategy for controlling it effectively. This is key to living your best life with the disease. The most critical decision is selecting the treatment approach that you will engage in. Seeking out therapy from a general practitioner, regardless of how good they are, will most likely result in treating signs of the condition rather than the condition itself. You can share your opinions with us and other audiences in the comments section. And if you enjoy the video, don't forget to subscribe to our channel. Looking for more amazing videos? Check out the videos popping up on the right and the left of your screen.